Good evening, everyone. On behalf of Dr. Agarwal's Institute of Optometry, I extend a warm welcome to each and every one of you. The topic for today, that is for the 15th episode of Optometry Series, is Humphrey Field Analyzer. The speaker for today is Ms. Vidhya. So let's quickly get into the topic. So if you have got any doubts during the presentation, kindly post your questions in the chat box. I request Vidhya to start the presentation.
Good evening, everyone. I'm Vidhya of third year, and I'm going to present HFA. Is my screen visible? Humphrey Field Analyzer. Before getting into that, we need to see what is visual field. The visual field is a portion of space in which the objects are visible at the same moment during the steady fixation of gaze in one direction. The normal field of vision for one eye in a person without any systemic or ocular problem is in the following slide. Extension of visual field. Maximum degree can be seen superiorly at 60 degree, inferiorly at 75 degree, 100 degree can be seen temporally, and 60 degree can be seen nasally. This is correlated with visual field loss. ARMD, usually called as age-related macular degeneration, neuropathy, macular edema, macula hole, retinal artery occlusion, Stargardt disease, scotoma, tumors, toxins and drugs. Perimeter. Perimeter is developed by Carl Friedrich Richard Foster, who lived 1825 to 1902. It is a device examines the visual field performed with a hemispherical surface where the visual field is performed. It works under the standard unit of measurements called differential light sensitivity. Types of perimetry. Perimetry is a technique using perimeter. There are two types of perimetry, kinetic perimetry and static perimetry. Kinetic perimetry is further classified into three types: manual, semi-automated, and automated kinetic perimetry. Static is of two types, which are Humphrey and automated static perimetry. Now, we are going to see about Humphrey Visual Analyzer in detail. HFA is a device measuring visual field and used for detecting monocular visual field defect. It is developed by Dr. Mike Patela, who is a US aerospace engineer and also a turned optometrist and a professor. Principle of HFA is a series of white light stimuli of varying intensity, that is the brightness, throughout a uniformly illuminated bulb. Terminologies of HFA. There are two types, central field and peripheral field, where the central field is from 0 degree to 30 degree and the peripheral degree is from 30 degree to 60 degree. Clinically speaking, in central, we have two classifications, where central is from 0 to 5 degree, where it includes fovea and macula, and paracentral is of 6 to 8 degree. In peripheral, we have classified into three parts, near, mid, and far. In near, it is from 9 to 30 degree, where at 15 degree it shows the blind spot, and mid peripheral is from 30 to 60 degree, and far peripheral is from 60 to 100 degree. Fixation point. Fixation point is the target where the patient looks, and isopter is a line connecting the equal points of sensitivity, and the depression is a loss of sensitivity. HFA 24-2 and 30-2 are the threshold tests. where the first number indicates the how far the fixation is and the second number indicates the testing points, both horizontally and vertically. And threshold means where the patient can see the dimmest light. 20-2 has 76 points and 24-2 has 54 points, which is represented in the below diagram. Screen testing. There are two types of screen testing, which is done for both central and peripheral. For central, it is of two types, C40 and C76. Both are tested at 30 degrees from the fixation, where C40 has 40 points and C76 has 70 points. C76 has a special identical test grid where it tests 30-2 threshold field, and it also has a default strategy test where it can detect the patient it is okay or further test is needed. Peripheral, it is also called full field test. There are two types, FF81 and FF120. Each test is 55 degrees from the fixation. FF81 has 81 points and FF120 has 120 points. We always use to check central first and peripheral second. Specialty test. 10-2 test is a specialty test where it tests 10 degrees from the fixation and it is given as 68 points. And macular test, it tests out a 5 degree where it has a 2 degree increment and it shows 16 degree tested points. And 60-4 is a threshold test that measures the area from 30 degree to 60 degree and it has 60 points. Testing strategy. There are 5 testing strategies, which is of full threshold, which is the slowest one, and fast pack, which is 40% faster than the full threshold, and CETA standard, which is called as Swedish interactive thresholding algorithm, which is 50% faster than the full threshold, and CETA fast, which is 80% faster, which is twice that of the fast pack, and CETA swap, which has yellow background and blue target, which is specialized for to help whether there is a glaucoma or whether the patient is going to get glaucoma sooner. Parameters for testing. The stimulus available are white target with white background, red target with white background, blue target with white background, and blue target with yellow background. It is for CETA swap. Room setup for the HFA. It works under the dim room illumination and there should be an AC and it should always be switched on. Preparing patient for the test. Proper positioning of patient has to be done. We have to show the response button to the patient to handle it properly. We have to patch the eye, which is not to be tested, and location of the trial lens is make sure it is proper and aligned with the eye, and the alignment of the patient eyes should be normal and the examiner has to be checked it properly. Testing procedure. Make the patient to sit comfortably and explain the procedure thoroughly to the patient. Patch the eye, which is not going to be tested. Ask the patient to place their chin in the cup and forehead should touch the machine. Ask the patient to see through the trial lens. Make sure the patient to see only the yellow light and not the white light, which is coming in the peripheral side, and ask the patient to press the button while the white lights appear. While testing the occluded eye, give some time to the patient to adapt from the dark adaptation before testing the eye. During the test, there are two things should be done from the examiner side and also the patient side. From the examiner side, we need to check for the patient whether the patient is looking around or looking at the target only, whether the patient blinks excessively or their lids are drooping. From the patient, we need to check whether their foreheads are aligned properly, their chin is placed inside the bowl, and the trial lens are aligned to the eye, and whether the mouth are closed or not. During the test, we also need to coach as well as encourage the patient. Example, click the button, even the lights are seeing them. Look at only yellow light and press the button when the white lights are appear and don't look at the white light. Teach together, chin in the cup and forehead touch the machine. Stay with me or almost done when they are falling asleep. And we need to appreciate when they are doing correctly. Interpretation. There are 8 zones which has patient data and test parameter, reliability indices, grayscale, total deviation plot, pattern deviation plot, global indices, glaucoma hemifield test, actual threshold value. First, zone 1. It contains patient's data and test parameter. This zone consists patient name, date of birth, their visual acuity, refractive correction if they has any, and pupil size of the patient. Test parameter, it includes test pattern which is performed and strategy which is used and fixation target which is being given. Zone 2, it is of reliability indices. It classified into 3 parts: false positive, false negative, and fixation loss. False positive. False positive are recorded when patients respond without the presented stimuli. It also called happy triggers. False negative are recorded when the patient does not respond to the stimulus of the higher intensity presented at the same location where previously the patient responded to a lower intensity stimulus. Fixation loss. Measure the patient gaze stability during the test. Grayscale. It is also called zone 3. It represents color-coded representation of the retinal sensitivity of the patient. It has 2 points, black point and white point, where black point values closer to 0 decibel and the white points values closer to 50 decibel. The points where is greater than the 40 decibel as seen as a white scotoma on the grayscale. Zone 4, total deviation plot. This zone comprises total deviation numerical plot, total deviation probability plot. This indicates the depth of field of defect. 0 indicates it has no deviation, and negative values, that is the decrease in the retinal sensitivity, and higher negative value shows worse retinal sensitivity. Zone 5, pattern deviation plot. This zone comprises the pattern deviation numerical plot, the pattern deviation probability plot. These demonstrate the presence of localized field defect and their pattern. This generalized decrease in retinal sensitivity would mean a uniform decrease in the height of field of vision compared with the normal database. Zone 6, it is of 4 types: mean deviation, pattern standard deviation, visual field index, and a p-value. Mean deviation, it is the average of all the values of total deviation of numerical number. Usually, it has a negative value. Pattern standard deviation, this shows deviation in the shape of field of vision. Usually, it has a positive value. Visual field index, calculated from the pattern deviation numerical number, it gives more weightage to the retinal points in the central area. It also indicates the percentage of retinal sensitivity of the patient. P-value, it indicates the probability of the particular finding of normal population. P-value lesser than 5% indicates a 5 or lesser than chance of for the index to be the specific value in a normal population. No P-value, normal value of the global index. Zone 7, GHT. It is called glaucoma hemifield test. Glaucoma affect the ganglion cell layer where 5 areas with the retinal points is calculated, is tested on both horizontal median and compared. The results are displayed as GHT within normal limits. Zone 8, actual threshold value. Anderson and Patela criteria. Abnormal GHT, the correction pattern standard deviation should be normal with the p-value less than 5%. 3 or more contiguous non-edge point of the 30-2 field, or 3 or more contiguous point of 24-2 with a p-value that is less than 5%, out of which at least has a p-value of less than 1%. These are the report example. Thank you.
Thank you so much, Sri Vidya. That was an excellent presentation. Dear all, I'm so happy to introduce today's moderator, Ms. Hanshi ma'am. Hi, Hanshi ma'am.
Hi.
Hi. Thank you so much for joining, ma'am. So introducing Anshi ma'am. Anshika ma'am is our very own family member here. So she's associate professor and also the academic in charge for postgraduates at Dr. Agarwal's Institute of Optometry. Hi, ma'am. We'd like to hear from you, ma'am.
Yes, thank you. So yes, Gomati, I would just like to congratulate Sri Vidya. It was a very nice presentation made by Sri Vidya, very detailed one. I would just want her to maybe just show us the final slide. If she can share the final slide again.
Yes,
is it possible?
Yeah, sure. Yes.
So as the sharing is happening, we've heard about a lot of information that the slide before. We've heard about all the information that she's given in the slides. So this particular slide actually has all the information in one particular page. So this is what is important for us to see when we are understanding a visual field report. So all the reliability indices. So whenever we get a report, it's important for us to actually have a thorough look at all the 10 numbers which are mentioned here. So the first thing that you will look at the reliability indices and the visual acuity and the pupil diameter of the patient. That is also very important. The reliability indices will tell us if the patient has actually given us the correct responses or not, or if the patient is actually very tired or a trigger happy patient, or he's not understood anything. So that's where we can find out the fixation losses or positive, false positive errors. Fixation losses will tell you when he's exactly not looking at the particular target. So that was very well explained. The point number two, which is the in the picture, is basically the threshold values. So these are the decibel numbers at which the person has responded. Okay. So from the threshold values, we get the grayscale map. And the grayscale map basically tells us a colored picture of how normal the visual field is. So the present one that she's showing is actually a normal visual field, right? We don't have any blacker zone. So if there is any region which is darker, it gives us an idea by just looking at the gray scale that it is some kind of defect. And following which we have the total deviation map and the pattern deviation map, which tells us how different they are, as in how the pattern is different. I don't know if the numbers are visible to you, but if you can look at 2, 1, -1, so that basically tells us how much they are deviated from the original values. And the hemifield test again will tell us about how much the patient is prone to get glaucoma, right? So all these things, when you're actually looking at in a paper, it's important. It's not just looking at the grayscale and telling that yes, the patient has this particular disease. And the other things where which I would like to just highlight is the places where we actually do a Humphrey visual field examination, which is not only glaucoma but also for papilledema, because in that we will see enlarged blind spots. We can also do it for optic neuritis. The common field effects in optic neuritis have been diffuse field loss, altitudinal field loss, central scotoma. So these are the things which we need to look for. We also have cases of ischemic optic neuropathy which have superior and inferior hemifield altitudinal defects. Even toxic optic neuropathy land up with central scotomas. If you have any disease which involves the chiasm, that leads into bitemporal hemianopia. And any disorders which are associated with your lateral genetic nucleus, that can also involve any kind of field effects, which basically would be a wedge shaped. Again, optic drusils, they do not have any visual symptoms, but the visual field defects are very common in these. And tilted optic disc is another common anomaly where the optic nerve makes an entry into the eye. So there you will see chiasmal defects, okay? And there are very common cases of malingering. So patients who say that they are not able to see. So in those cases, you will actually have a pattern in the visual field. So they will actually not have a problem in seeing, but the pattern will tell us that they are actually malingering. Apart from that, we have vascular disorders like BRVO, CRVO, where you will again see the kind of which segment is involved. It could be just the superior arcuate or the inferior arcuate defects. We also need to know which kind of disease we are dealing with. Is it a central field loss or a peripheral field loss? For example, RP, which is retinitis pigmentosa. So you will see in the grayscale that the periphery is completely dark. It's completely black. Whereas if you have a central field, any macular problem, the central region is going to be darker. And patients with migraine also can have sometimes visual field defects. So these are the common things which I wanted to highlight because the presentation by Srividya was very detailed. So we also need to know how do we link it with specific diseases.
So thank you, ma'am. Any questions, anyone? If you have any questions, kindly post in the comment box. We'll get back to you with the answers. Thank you so much, Anshi ma'am, for joining today as the moderator. Thank you so much, ma'am.
Thank
Dear
you.
audience, yeah, thank you, ma'am. Dear audience, Thank you for your continuous support towards the Optometry series. If you have any questions for today's session, kindly post it in the comment box. We will get back to you with the answers. The update about the college for this week is the admission is open for Masters in Optometry and Fellowship in Optometry and Internship in Optometry. To know about, or if you wanted to have a query, or if you got any queries or to contact, kindly call 97890 I will put the number in the description box also. If you find this video useful, kindly share it with your friends. Give a thumbs up. To know more about the college, kindly follow our social media pages. The link will be given in the description box. Thank you all so much. Meet you all in the next episode. Bye bye. Thank you, ma'am.